Let's talk Mental Health Matters with Dr. Ola Ajile on the Veil of Sanity. Dissecting the mind, Dr. Ajile is a psychiatrist and forensic physician in the UK.
Before we go into all this, I think it's important for me to talk about the mind frame and the personality type of a domestic abuse perpetrator. You may not have this slide. If you just keep the slide there, I'm going to talk about this from my own hand here. Now, I'm going to be saying this, and I'm not passing judgment on anyone. I'm talking about this from clinical point of view and standpoint, and from my own experience as a practitioner in mental health. So we have to call a spade a spade. Something is definitely not right. You know, when somebody becomes an habitual domestic abuser, something definitely is not right. No, it doesn't always involve, physical violence, as you said. That may not be a display of anger. So it's one of the myths that, after all, I'm not eating you, I'm not, beating you up, I'm not slapping you. Therefore, how can you call me a domestic abuser? But yet you are doing some damage. You're doing some damage. And we will understand that from the mind frame of these people. Now, the general rule is that somebody who is a habitual domestic abuser is a psychopath. It's a psychopath. You may ask me the question, what is a psychopath? Now, they can be also called sociopaths. It's a personality trait. It's a terrible personality trait. Yes, they have severe form of personality disorder in clinical setting, because if you look at the definition of personality disorder, it's an enduring ways and patterns of behavior that is persistent, that is pervasive across all domains, and often causes difficulty in interpersonal relationship and distress to others. So it's a type of personality disorder. It is a clinical entity. So it's not just a social entity, it's a clinical entity. And when you see somebody who is an habitual domestic abuser, you will need to ask them, do they need to seek help? Do they need to seek help to identify why they've turned out to be like that? Something makes them to have this kind of personality framework that makes them continue to cause mayhem and inflict pain to others. But we need to look at what exactly is in their mind. What do they do? Why do we say they're psychopaths? When we talk about psychopaths, people think we're talking about criminals alone. People who goes and carry guns and shoot people or, cut people off and all those things. No. A husband can be a psychopath. A woman can be a psychopath. And they can be perpetrators of domestic violence. Now, what does that mean? It is an antisocial behavior. What do they have that is different from normal behavior or personality? They become very impulsive. They have low threshold for discharge of aggression and anger. Every small thing upsets them. They retaliate by violence. They have inclination to violence. And they have impaired empathy. Impaired empathy. That word is very important because we're going to talk about that. Because that's the central, key factors in their mind frame and how they work and what makes them, become an habitual, domestic abuser. They have no remorse. They have callous emotional disconnection from the pain and the distress of other people. They don't care. They don't share the pain with other people. They are disinhibited. They have ego, very high ego and high self-esteem. They are unduly proud of themselves. They don't see anything as wrong. They feel they're untouchable. And this is the kind of mind frame of somebody who is a perpetual domestic abuser. If you have anybody acting like this, then you need to call them to question. You need to ask them whether they need to see their doctors and seek help. Now, they are completely disconnected from the pain that other people feel. Now, when you physically abuse somebody or emotionally abuse somebody, they are subdued, they are dehumanized, but you don't care about what they feel. And that is where the word empathy comes into play. These people have impairment of empathy. Now, they have difficulty learning from the mistakes or consequences of their behavior. So they keep repeating this thing all the time. They keep doing it all the time. And they have a manipulative way of doing it. And they keep doing it in a way that they don't see that they're causing any harm to others at all. They're very, very cold and deliberately self-serving and very calculative. Now, we need to explore about them again. Now, they suffer from persistent, sometimes mostly unprovoked inclination to violence, as we said earlier. Now, we're talking to those ones, men and women in domestic setting now. Now, what is empathy? Empathy is the capacity to understand or feel what another person is experiencing with their frame of reference. Now, if you can put yourself in other people's shoes, that if I'm hurting this person, would I take it if it were to be me? But if you're in a situation whereby you are incapable of deciphering that or discerning that other people or my behavior towards them is causing them grief and distress, then you're a psychopath. You're more likely to commit domestic abuse. They are more likely to commit domestic violence towards your partner or towards your loved one. To be able to discern what another person is feeling or thinking is empathy. They do not have that. They cannot relate to your pain. They cannot relate to your yearning for peace and self-preservation. Now, ideally, everyone is born with the capacity to feel empathy. But these people, for some reason or the other, they've lost these things. They've lost it. And therefore, their behavior continues on and on. And you will see that most people who are in a domestic abuse situations, unless they do something about it, it's most likely going to continue. Particularly if you are living with somebody who is an habitual abuser and they're psychopath, they need to change. And it's difficult for them to treat. Once a personality is formed, it's often difficult to change it. And they will need special intervention to be able to help them with that. Now, part of empathy is also a capacity to make less distinct the differences between self and others. If you're a breadwinner, you're a breadwinner. That doesn't mean you should be arrogant to your wife because she may have other roles. But these people think, after all, they are the breadwinner, therefore they are capable of doing whatever they need to do, and nobody should question them. They're arrogant, they have pride over, and because they have, a particular economic difference between them and their wives. Empathy is the capacity to place oneself in another's position, to feel and share another person's emotions. It's an emotional state that requires cognitive empathy, social and affective empathy, and somatic empathy. Now, so we can see why we call these people, psychopaths. For you to be able to be empathetic, you have to have a tender heart towards other people. Now, you need to make a distinction between empathy and pity now. Now, to feel pity is a feeling that one feels towards others that might be in trouble or in need of help, as they cannot fix their problems themselves. But psychopaths don't wait for you to be in trouble. So they don't, they don't wait for you to be in trouble. It can just happen anytime. So, they do it regardless. In fact, they are troubled themselves and they show no remorse to the confusion and destruction they bring. Now, it's also not the same thing as having sympathy or compassion. Empathy is different from that. Because people with, unempathetic behavior, they don't have the cognitive state of flexibility to be able to appraise other people's actions, why you do something. They just jump to conclusion and they blame you all the time for what is wrong, in your relationship, in your marital life. They don't take responsibility for it.
Have you learned something? Join us again, and thanks for listening.